Most people over 60 are told the same thing. Some hearing loss is normal, so just turn the volume up. It sounds sensible. It sounds safe. But here is what nobody tells you. Turning the volume up alone does not protect your memory, and it does not protect your independence. In 2020, an international group of researchers published a major review in The Lancet on preventing dementia. They ranked hearing loss as the single largest modifiable risk factor in midlife, not one risk among many, the largest one on the entire list. Today, I am going to give you 5 specific things that connect your ears to your memory, counting down from 5 to 1. And I'm going to give you the one thing a routine appointment almost never covers. The number 1 item on this list is something almost nobody talks about. Stay with me until the end, because that one can change how you approach the next 10 years. Now let me tell you why your doctor has probably never raised this with you. The average appointment runs about 12 to 15 minutes. In that window, your doctor has to check your blood pressure, review your medications, and handle whatever brought you in. Hearing is almost never the reason you booked, and unlike blood pressure, hearing loss does not show up on a routine blood panel. It arrives so slowly that nobody in the room notices it, including you. I am not here to sell you a supplement or scare you into a course. This channel exists to give you the science a 12-minute appointment never has time to cover. There is nothing to buy at the end of this video. There is only something to do tonight. And the stake here is not a small one. Untreated hearing loss is linked to falls, to pulling away from the people you love, and to faster memory decline. Those 3 things together are exactly what takes a person out of their own home. So before we go further, tell me in the comments how old you are and where you are watching from. I read those, and they tell me exactly who I am talking to. Here is the one mechanism behind everything in this video. Your brain has a fixed amount of processing power available in any given moment. When the sound arriving at your ears is faint or blurry, your brain must spend extra power just decoding the words. That power has to come from somewhere, and it comes out of memory and attention. Think of your brain as a house running on one electrical panel. Every room draws from that same panel. When the listening room starts running a space heater all day long, the lights dim everywhere else. The memory room gets less. The attention room gets less. That is not a poetic way of describing aging. That is what listening effort actually does inside your skull. Every hour you are awake. Please do not skip this section. It is the key to everything that follows. If this is already making sense to you, tap the like button so more seniors can find it. That is genuinely what decides who this video reaches. Number 5 is the number on your television remote. Not whether you can hear the television, but the exact number the volume sits at. Hearing loss in later life rarely arrives as silence. It arrives as a slow fade over 10 or 15 years. Your brain adapts to each small drop without ever telling you about it. Imagine a room where someone dims the lights 1% every month. You would never notice the moment it got dark. You would only notice that you had started squinting. Researchers at Johns Hopkins have followed thousands of older adults on this exact question. Their work found that even mild hearing loss was associated with roughly double the long-term risk of dementia. So here is tonight's test. Turn on the evening news at your normal volume and write that number down. Then ask a family member or a neighbor to sit in the same chair and set it where they find it comfortable. Write their number down too. A gap of more than 5 points is a real signal. A gap of 10 or more means you book a hearing test this month, not next year. And here is the mistake people make with this. They test it with a loud action film instead of the news, and voices are what matter here, not explosions. If you live alone and there is nobody to compare with, use the caption test instead. Turn closed captions on for 1 full week and notice how often you are reading rather than listening. If you are reading more than half the dialogue, that is your answer. And please never test your limits by turning the volume as high as it will go. Loud is not a test. Loud is damage. Pair this with one small habit. Write that volume number on a card by the television once a month. 1 reading tells you where you are. 6 readings tell you which direction you are moving, and direction is the thing that actually matters. Now, the television number is about volume. Volume is the easier half of this problem. Number 4 explains why you can hear perfectly well at home and still feel completely lost the moment you walk into a busy room. Number 4 is the restaurant problem. That is the moment a room fills with noise and words stop making sense, even though you can clearly hear that people are talking. High-frequency hearing almost always goes first. High frequencies carry the consonants, the S, the F, the TH, the K, and the T. Vowels are low and loud, so they survive. So you hear that someone spoke, but not what they said. It is like a newspaper printed with every consonant faded out. The page still looks full. You still cannot read it. Large clinical studies have consistently found that adults with untreated hearing loss withdraw from social activity years earlier than their peers, and social isolation is itself a well-established risk factor for cognitive decline. Here is the protocol, and it starts with where you sit. Ask for a booth or a corner table with your back to the wall and the noise in front of you. Sit with your better ear turned toward the person you most want to hear. Keep the group to 4 people or fewer, because past 4, the signal collapses into noise. Ask for a table away from the kitchen and away from the bar. And when you miss something, stop saying what. Say, could you say that a different way? Rephrasing works far better than repeating because a fresh set of consonants gives your brain a second chance at it. If standing in a loud room leaves you unsteady, that is not in your head. Your hearing is part of your balance system, and straining to listen pulls attention away from your feet. So find a wall or a chair back to touch when you are talking in a crowd. And if you get dizziness, ringing, or a blocked full feeling in one ear only, stop and get that ear looked at. A sudden change in one ear is urgent, not normal aging. Pair the seating strategy with 1 refusal. Do not accept the seat facing the kitchen just to be polite, because that single choice decides whether you finish the evening connected or exhausted. And hold number 1 in the back of your mind while we go, because everything so far has described the problem. Number 1 is the 30-second test that tells you whether it is happening to you. But number 3 comes first, and number 3 is completely reversible. It is the single most missed reason a person over 70 stops hearing well. Number 3 is impacted earwax. Not ordinary earwax, which is healthy and protective, but a hardened plug that seals the ear canal shut. As we age, earwax itself changes. It becomes drier and harder, and the tiny hairs that normally sweep it outward slow right down. Hearing aid domes and earbuds push what is left even deeper. A full plug can cut your hearing by as much as 40 decibels, which is the difference between a conversation and a mumble. Picture a garden hose with a kink in it. There is nothing wrong with the water pressure. The path is simply blocked. Ear, nose, and throat clinics see this every single day in older patients. And it is one of the very few causes of hearing loss that can be completely reversed in a single appointment. Here is what to do. Ask your doctor or nurse to look in both ears at your next visit and ask the question directly. Is there wax blocking my canal? If there is, professional removal usually takes about 10 minutes. If you want to soften it first, the standard approach is a pharmacy softening oil, 2 to 3 drops twice a day for 3 to 5 days before the appointment, not longer than 5 days without advice. And then let a trained person do the actual removal. Now the safety part, and this one matters more than the protocol. Never put a cotton swab, a hairpin, a key, or anything else into your ear canal. You will push the plug deeper and you can perforate the eardrum. Never use ear candles because they do not work and they cause burns. If you have ever had a perforated eardrum, ear surgery, or tubes, do not put any drops in without asking your doctor first, and any pain, discharge, or bleeding means you stop and get seen that same week. Pair this with your annual physical. Write ear check on the same card as blood pressure. That way it happens once a year without you ever having to remember it. So number 3 was a blockage on the outside. Number 2 is about what feeds the inside, and it is the reason 2 extremely common conditions quietly steal hearing decades before anybody connects them. Number 2 is the blood supply to your inner ear, specifically your blood pressure and your blood sugar. Deep inside your ear sits the cochlea, a spiral about the size of a pea. It holds roughly 15,000 hair cells that turn sound into nerve signals. Those cells are fed by one small artery with almost no backup route. Most of your body has spare roads. The cochlea has one road in, so when small vessels stiffen from high blood pressure or get damaged by high blood sugar, the cochlea is one of the first places to starve, and those hair cells do not grow back. Large population studies have consistently found higher rates of hearing loss in adults with diabetes, at roughly twice the rate seen in adults without it. High blood pressure shows the very same pattern, so the protocol here is not an ear protocol at all. It is a circulation protocol. Know your 2 numbers and know them in writing. Blood pressure taken at home, seated, feet flat, after 5 minutes of rest, twice a day for 1 week, and bring that record to your doctor. And your hemoglobin A1C, which is your 3-month average blood sugar, checked at least once a year after 60. Then add movement, because movement is what drives blood through the smallest vessels you own. 20 to 30 minutes of walking, 5 days a week, at a pace where you can talk but not sing. The senior safe version of that walk is a supported one. Walk a hallway where you can touch a wall or push a shopping trolley, or start on a treadmill with the handrails within reach. Break it into 3 10-minute walks if 30 at once is too much, because the benefit to your vessels adds up either way. And if you take blood pressure medication or any diabetes medication, talk to your doctor before changing anything, including your exercise level. Chest pain, sudden dizziness, or new ringing in one ear means you stop and call, not push through. Pair the walk with the salt shaker. Bringing sodium down toward the 1,500 milligrams a day commonly recommended for older adults lowers pressure in the exact same small vessels the walking is trying to open. One habit opens the pipes, the other stops them narrowing. Everything so far has been about protecting hearing or finding the causes behind losing it. But none of it answers the one question that actually matters tonight. Do you have hearing loss right now? And if you do, what happens to your brain if you leave it alone? That is number 1, and it is the part almost nobody talks about. Number 1 is the whispered voice test and what you decide to do with the answer. Let me explain what untreated hearing loss actually does to a brain over years, because 3 separate things happen at once. The first is listening effort. Every faint sentence costs extra processing power, and that power gets taken out of memory and attention. The second is auditory deprivation. When sound stops arriving, the hearing regions of your brain shrink, in the same way a leg shrinks inside a cast. Brain imaging research has shown measurable loss of tissue in exactly those regions. The third is withdrawal. Conversation becomes work, so you stop going and your brain loses the richest exercise it will ever get. Put those 3 together and the picture is clear. It is not that quiet ears cause dementia. It is that a brain starved of signal, working overtime, and left alone, ages faster than a brain that is properly fed. In 2023, results were published from a large randomized trial called Achieve, run across several sites in the United States. Close to 1,000 older adults were assigned either to hearing treatment or to a health education program. Among the participants who were already at higher risk of decline, the hearing treatment group lost cognitive ground at about half the rate over 3 years. So here is the 30-second test. You need one other person and a quiet room, and both of you should be seated. Sit behind them at arm's length about 2 feet away so they cannot read your lips. Have them gently press the flap of the far ear closed with 1 finger. Take a normal breath, breathe all the way out, and then whisper a set of 3 items. Say a number, then a letter, then a number. For example, 4K2. Ask them to repeat it back to you. If they miss more than one of the 3, do it again with a completely different set. Then swap ears and then swap places so that you get tested too. Missing more than half of 2 different sets in either ear is a fail. And here is the number that matters most in this whole video. On average, people wait 7 to 10 years between first noticing hearing loss and doing anything about it, and that decade is exactly the window we have been talking about. Do this seated, both of you, because turning your head while standing is a fall risk, and this is not worth a stumble. Do it with the television off and the fan off because background noise invalidates the result completely. And understand clearly what this test is and is not. It is a screen, not a diagnosis. A pass does not rule hearing loss out, and a fail does not diagnose anything at all. Either way, the next step is identical, which is a proper hearing test with a licensed audiologist. It is painless, it is free or low cost in many places, and it takes about half an hour. And if one ear fails badly while the other passes, or if your hearing drops suddenly over days, treat that as urgent and call your doctor this week rather than booking a routine test. Pair the test with a decision you make in advance. Decide tonight, before you know the result, exactly what you will do if it fails. Because the barrier here is almost never the test itself. It is the 7 years people spend deciding, and in the United States, since 2022, hearing aids for mild to moderate loss can be bought over the counter without a prescription, which removes one more excuse from the list. And this is the part almost nobody talks about. We buy crossword books and brain training apps hoping to protect our memory. But the largest single modifiable risk factor on that Lancet list was not puzzles. It was hearing. Treating your hearing is not vanity, and it is not about volume. It is the most direct thing you can do to keep your brain properly fed for the next 10 years. Hearing is not vanity. Memory is not luck. Independence is protected on purpose. Consider a typical case documented in the rehabilitation literature. A 74-year-old woman had stopped going to her church coffee morning. Her family assumed she had simply become withdrawn, and one of her daughters had quietly started using the word confused. She had also scored poorly on a short memory screening at her doctor's office. Her doctor did 2 things before anything else. He looked in both ears and found a hard wax plug in the right one, which was removed that same week. Then he referred her for a full hearing test, which showed moderate loss on both sides. She was fitted with hearing aids and told to wear them 2 hours a day at first, adding an hour each week. By the end of the 3rd week, she was wearing them from breakfast until the evening news. 4 months later, she repeated that memory screening and scored several points higher. She was back at the coffee morning on Tuesdays. Nothing about her brain had been treated. The signal reaching it had simply been switched back on. So here is exactly what to do, and almost none of it costs anything. 5 steps, and the first 2 happen before you go to bed tonight. Tonight, do the 30-second whisper test with one other person. Both of you seated, both ears, 2 different sets of 3 items each. Tonight also, write down the number your television volume sits at on a card you keep beside the set. 1 number, 1 date, 30 seconds of work. This week, book a hearing test with a licensed audiologist. Not next year. This week, especially if either ear failed that whisper test. And while you are on the phone, add ear check to the list you carry into your next appointment right underneath blood pressure, so somebody actually looks for a wax plug. This month, start the walk. 20 to 30 minutes, 5 days a week, supported at a pace where you can talk but not sing. 3 10-minute walks count exactly the same as 1 30-minute walk, and every month from now, 1 more number on that card by the television. 12 numbers a year is a hearing record no clinic will ever have on you. Now think of someone in your life who has started asking people to repeat themselves. A brother, a neighbor, a parent. Send them this video. Because the person who needs this most is almost always the very last one to notice. And tell me in the comments which of these you are starting tonight. Your answers decide exactly what I cover next. If this is the kind of thing you want more of, subscribe. This channel exists to give you the science your appointment never has time for. This video is education, not a diagnosis. Your own doctor knows your history, so bring this list to your next appointment. I'm Judy Vance. Don't forget to subscribe and live longer.